Meanwhile, time for Prescription for Truth. Back in September, when President Obama was campaigning for support for his healthcare reform, he made a promise about who would be covered.
There are also those who claim that our reform efforts would ensure illegal immigrants. This, too, is false. The reforms I'm proposing would not apply to those who are here illegally.
But now some Democratic lawmakers are using the current immigration reform debate to help illegal aliens gain access to federally funded health care. But they claim they're just trying to make sure immigrants have access to Medicaid and Medicare once they are given permanent resident status. We're joined by Peter Johnson Jr. with the Prescription for Truth. It seems to me, right after that little soundbite we just played, Joe Wilson from South Carolina said, "You lie."
He did, and the country was in an uproar. But now, based upon what we're hearing from the Congressional Hispanic Caucus, there appears to have been a deal that's been made, although no one will confirm what the deal exactly was, to bring $10 to $30 billion in health care to what once were illegal immigrants to this country.
Wait a second. I just clearly heard the President of the United States say that illegal aliens will not wind up with health care.
It was not in that Health Care Reform Act.
Well, then where is it?
But the idea is from the Congressional Hispanic Caucus to go forward with comprehensive immigration reform. And as part and parcel of that, to ensure on the path to citizenship that people who are currently illegally in this country have the opportunity, really almost immediately, to get the same health care benefits through Medicaid and Medicare that other Americans now have. Under the plan that the president put forward, even legal residents have a 5-year waiting period to receive those Medicaid benefits.
So what you're saying is it was a kind of a two-part deal. First, let's pass the health care thing, and no illegals can get health care in the health care bill. But when we pass immigration reform, then suddenly those people over here, the 11 million or 20 million, however many they are, then they would be entitled under the new rules to get it.
Correct. And officials of the Congressional Hispanic Caucus are saying, listen, we're not going to say there was a specific commitment from the president. We don't really recall that conversation, but that we had assurances at high enough level. If you remember, they were saying during that health care debate, we're going to walk away from this.
Yeah.
We're not going to vote for this proposal. And so now,
they flipped at the end.
Well, now in 2 days we know that what we thought to be a tax was denied to be a tax, is really a tax.
Right.
Now we see, looking back on the president's statements to the Congress, that the immigrants were not going to be covered, and now we hear the rumblings and the suspicions and the intimations that the Congressional Hispanic Caucus wants to collect on a promise that was made to them to deliver health care to at least 11 million illegals. This is a flashpoint discussion in this country, and it brings together these two big issues, immigration and health care, and we're going to see what happens.
All right. Peter Johnson Jr., keeping an eye on it.
Good to see you. Okay.
All right. Straight ahead, how would your dog...